Opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Miami, Broward, and Palm Beach County. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And I am delighted to introduce everybody to Dr. Harris. He is at the Conde Center, and that's right here in Delray. The address is 401 West Atlantic Avenue, Suite 014, Delray Beach, Florida 33444. The phone number is 561-330-6096, and the website is www.thecondecenter.com. Welcome to the show, Dr. Harris.
Thank you for having me.
Absolutely. I'm so excited to pick your brain and learn about all that you do, because I've been researching and reading a little bit, so it's real exciting. I usually like to kind of share with the audience, if you want to tell us a little bit about your background and maybe what made you want to become a doctor, and just a little bit about where you went to school.
Absolutely.
Sure.
So I am a double state licensed chiropractic physician.
Nice.
We at the Conde Center specialize in all non-surgical options for spine, extremities, pre-op, post-op. A lot of times people hear chiropractic physician, they think of the adjusting and manipulation, and we do tremendously more than that. So rehab-based exercises and then all of our advanced treatments. I really got into it because I had a back injury originally.
Wow.
And so I figured out that I want to devote my life to being able to educate patients in the population on why backs get injured, how they get injured, and then how to try to avoid some of the surgical intervention and things. Mm-hmm. Now, if we need surgery, we need surgery, but
Sure.
but if we can avoid it at any cost, we want to try, of course.
Mm-hmm. And where did you go to school?
So I went to undergraduate at Texas State University,
Nice.
just south of Austin and San Marcos, Texas.
Mm-hmm.
I was pre-med, exercise sports science. And then with the back injury, I said, okay, I really want to devote my life to spine specialty. So moved back to Dallas, where I'm from originally, and then I went to Parker University for my chiropractic degree, my doctorate of chiropractic, and then I've got some postgraduate training and things like that.
Nice. So you've been in Florida for a few years now?
I have. I love it.
Absolutely. Well, we're happy to have you. We're always excited to have doctors like yourself that are experienced in all these different modalities and all that you do at the Conde Center. So yeah, a couple of questions. We do have sometimes a senior population that's listening, so we're curious to know, how does age affect not only our spine, but our bodies as a whole?
That's a big one. That's a good question. So largely as we get older, gravity affects humans differently. We're the only bipedal animals on the earth, so really walking on 2 feet. So the way that gravity affects our spines as compared to a dog or another animal or something that is quadruped or on fours, it's going to be affected a lot differently. Also, just the nature of the 2025 lifestyle is a lot of sitting, driving. We're not climbing trees to get food anymore, right? We're not doing any of that. So our spines are affected differently. And then through a natural aging process, bones become more brittle and osteoporotic or osteopenia. We get sarcopenia, which is a withering of muscle tissue and things like that. So gravity affects us differently, and then also metabolically, our bodies slow down a little bit. So really Isaac Newton was onto something. It wasn't just apples falling out of trees. It's keep your body moving. The object in motion stays in motion. So we want to try to continue to move against gravity and fight against gravity, because you've heard the age-old death and taxes, right? Well, and gravity, right?
Yes,
gravity is also a constant, always acting against us. So continue to move your body and put things in your body that are productive for yourself. Helps tremendously.
You know what I've noticed a lot, Dr. Harris? Younger kids, I don't know what they call it, tech neck, but I see younger kids, because we're always on our phones, and the younger kids have been doing it since they're 5, 6, 7, right, or birth, I don't know.
Definitely.
But I see younger kids now that are a little more arched.
They are, and we've seen this in research and looking at trending populations over the last 5 or 10 years, and probably more so, even longer than that. But they finally coined a term, and researchers and doctors, it's not text neck as much, even though that's what's causing it a lot. Is upper cross syndrome. So they've got a new syndrome, a new name for it, which is tightness and pulling in certain muscle groups because of this slouched over type posture, which you can get away with it 6, 7, 8, 9, 10, even into your 20s possibly, but eventually that gravity is going to catch up with you, and we start to see degenerative changes through the spine and through the adjacent joints and things like that. So perfect place to people watch is the airport. I always go in the airport, right? You go around the airport and you see people that are tired and they're flying and they're on phones and computers, and you see that big slouched over posture. So definitely something we want to be aware of, and try to keep kids and ourselves from not doing that as much as we have been.
Yes, for sure. So you guys offer so many. I was just doing a little research and looking at the website and whatnot. You have so many different treatment plans. Maybe we can discuss some of them. Non-surgical spinal decompression, laser therapy, extracorporeal shockwave therapy, and the list goes on. Can you tell us a little bit about some of the treatment plans that you offer? I imagine you have all different ages going to your location.
Definitely.
Tell us about some of the treatment plans that you offer.
So largely the way we've set up Conde Center and how Dr. Conde has set up the center is we wanted to be the leading office of non-surgical advanced treatments. So we don't do anything cookie cutter. I always tell patients that is we need to tailor treatments, and more so with any healthcare approach now, it needs to be tailored to what the patient needs, because we are very dynamic and different from person to person. So first it starts with sound diagnostics, right? It is whether it be diagnostic imaging, physical exam, we compile everything. On Dr. Conde's side, on the neurological side, he's got a lot of different VNG mapping and brain mapping and things to be able to see where the patient is baseline, whether it be biomechanically in their spine and their body, or neurologically from a central nervous system point of view from the brain. So then we can go from there and say, okay, we have a baseline now, we know how you move, we know about prior injuries, and we start putting the puzzle and the story together, and then we decide as the practitioner and as the clinician, okay, what is the best route for the pathology, the injury that is hurting this patient. And with those ones that you discussed, the non-surgical spinal decompression.
What is that like?
You say that 5 times fast, right? Non-surgical spinal decompression is a way to decompress spinal disc, intervertebral disc, without having to open the tissue. We can apply it into the cervical, the thoracic, and lumbar spine from a machine based on patient presentation, body weight, all those other things we discussed. Then we apply a slow decompressive force with a small oscillation. And this will rehydrate discs, and it takes pressure off of nerves, and it helps combat back to the gravity and then wear and tear to the body. So that is a great treatment for spinal issues. Even if it is not an injury or active disc herniation or something like that, it will combat some of this degenerative change through gravity and through our spines. It's going to happen naturally. And then the other 2 big treatments we offer on the orthopedic side or the physical medicine side is the photomedicine treatments. And those are class 4 laser treatments. It's called biophotomodulation. It is a class 4 laser that is technically classified as a surgical laser. We do not use it to cauterize or cut tissue, but it will help with blood flow, nerve injuries, lymphedema, healing process for surgical sutures, things like that. They use it a lot in animals. Veterinarians use it a lot for healing time after surgery for
Is that like
dogs,
a red
cats.
light therapy?
Very, very similar. So it uses a type of photon or a type of light, but it's an actual laser that is used to apply through the skin. We have certain parameters and things in certain populations we cannot use it on, of course, just like the non-surgical spinal decompression. And then the last big treatment is another one that we need to know exactly the parameters, but that's the extracorporeal shockwave therapy.
Wow, this sounds like the Jetsons.
It is, right? It sounds just like
it.
It is. So this one, and people may have heard of shockwave lithotripsy. Those are the kidney stones that they use to break up kidney stones with certain shockwave type machines.
I have heard of
So
that.
similar machine that is high frequency acoustic waves that are used for more so breaking up tissue and helping with blood flow. So scar tissue buildup, any sort of adhesive fibrotic changes on sutures, plantar fasciitis. A lot of people have heard of that one. So breaking up tissue more so with that intervention, and then also helping with healing time and with blood flow largely.
Wow. So people who have had injuries and they have that tissue, that helps with that. There's
Absolutely.
there's so many treatments out there that we get to educate ourselves on. Instrument assisted soft tissue mobilization technique. What is that?
So once again, say it 5 times fast. Right?
Yes.
They have acronyms for all these.
Oh, yeah, I'm
so
sure.
they use different types of tools for this. Really, it looks like a fancy butter knife. But what it is small pieces of metal, rigid metal, that are contoured in certain ways to scrape through tissue that has trigger points or those knots, those stubborn knots that you feel in certain areas. Putting the body into a certain position and then doing this instrument-assisted soft tissue will help break up tissue and help with blood flow in conjunction with small manipulations when indicated, physical medicine, therapeutic exercises, and those other treatments works phenomenally.
I love how it's, from what I'm learning, it sounds like it's just precision medicine. You look at the person and you decide what they need, and everyone, like you said, it's not cookie cutter.
Absolutely.
It's really precision medicine at its best, which is what we all want.
Definitely,
You know, we want
definitely.
what's going to be best for us, right? Hot and cold packs. It sounds so simple, but what? Tell us about hot and cold. What?
Okay, so hot and cold, this is the question I get. I get these questions
Yeah.
daily. Shoes, mattresses, which one's better, all these different
Yeah.
things. When it comes to hot and cold, and research, as you know, with anything, kind of will flow back and forth when they look at these types of interventions, anything, even hot and cold packs. I use the general rule of thumb when I'm telling patients for ice, when we want to ice something, is something inflamed. And typically people think of, and I use the example of, you've rolled your ankle and it kind of swells up.
Yeah.
We don't want to put heat on that and bring more blood to the inflamed site. We want to do the old RICE, right? Rest, ice, compress, elevate. So ice, I tell, will contract tissue slightly, make things a little more stiff, but it will calm down inflammatory injury, things like that. And then with heat packs, we're thinking of more of stiff, right? Stiff in the morning, real stiff and achy. I'm not moving very well. Brings blood to the tissue and helps also loosen tissue. But really, in a nutshell, it's if it's not moving enough, heat. If it's swollen or throbbing,
Got
ice.
it.
Both of which are going to help with local blood flow. So
it.
ultimately, that's what we want.
Yeah. I started doing cold plunges.
There you go. There you go.
I started about 3 months ago.
And how'd you feel?
I'm doing it for like a minute a day. I don't do more than that.
A minute's enough.
Minute in.
A minute's enough.
It is more than
It
enough.
sounds like a small amount of time, and then you get in there and you realize a minute's a long time.
But I feel long-term effects.
Definitely.
I do. I don't know if it's just in my mind, but I feel great.
It helps speed up metabolic process. It helps reboot the system. We've talked about cold showers recently too. Cold immersion of any type helps tremendously in cell repair and tissue healing.
It's so amazing, like just the basics, right? Just back to
Absolutely.
basics of what we can do at home, right? As
Easy.
well, as well as coming to see you at the office. Medical massage, we all want a good massage, but a medical massage, I like that because it sounds like also precision and tailored to the patient.
Definitely. And we do, we have a specialist in-house. He's a CMMT, it's a certified medical massage therapist.
Nice.
He's phenomenal. Little extra training. They're more versed in some anatomical anatomy, but also in just knowing where there's injury too, which is a big deal. So someone comes in post-op, shoulder, wrist, knee, the practitioner of any kind, especially even a massage therapist, needs to know that this area may be sensitive and what muscles that connect in that area may be implicated. So it works wholly in the fact that, back to those treatments, is a lot of times with the human body, we're too dynamic. So one intervention that works for you may not work very well for someone
True.
else, even if it's the same body part. So
Good
tailoring
point.
those treatments of attacking injury from multiple different angles and figuring out what works best for that patient. A lot of times that deep tissue or that medical massage of getting the soft tissue moving on top of those treatments helps tremendously.
Yeah, it's a combination of efforts. Yeah, I know for sure. I've pulled my back out and I know the feeling, and I've had to have medical massage and cupping, and it's tremendous.
Definitely.
To help alleviate, the pain and the stiffness.
Exactly.
For sure. So we did talk about the diagnostics. You do the digital x-rays when they first come in. So let's say this. So if someone first comes in, you do all those different diagnostics and then you do a treatment plan. Is that how it works?
Yeah,
You
and
suggest a plan?
with radiographic examination or with X-ray, X-ray is there for ruling out ominous dislocation, fracture, bone tumors, things like that, but it is still a radiographic examination. It is a plain film X-ray. It's on a digital screen. It's very, very good X-rays nowadays,
Yeah.
2025.
Sure.
But we don't use it in the fact to look at, how you're leaning or things like that. I can place somebody with their head up and take a picture and say, wow, look at the curvature in that spine, looks great, and then have them kind of move their head down, take a picture. Oh no, the curvature doesn't look well, or
see.
look very good. So we do read it more medically. So we're looking at wear and tear, degenerative change. When it comes to arthritis or arthritides, the big one, a lot of people have heard of arthritis. Osteoarthritis, really two things need to be present for osteoarthritis on imaging. It is decreased joint space, so it should be this big and it's this big.
Okay.
And then osteophytos, or little bone spurs.
Okay.
If we see
we got
those
a quick
two things,
commercial
go
break.
ahead.
I'm sorry. We'll
No
be
problem.
right back. I want to continue this conversation. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, everybody. Thank you for tuning back in. We are having a delightful conversation with Dr. Mason Harris. He is right here local in Delray Beach at the Conde Center, and you can certainly go to the office at 401 West Atlantic Avenue, Suite 014, Delray Beach, Florida 33444, or you can call and make an appointment 561-330-6096, and the website is www.thecondecenter.com. So we were discussing x-rays, and you were telling us you can have somebody stand straight, take an x-ray, and then you have the different iterations. Maybe we can continue on what you were saying. And
so it's the explanation of the osteoarthritis, and people have heard arthritis and they don't exactly know what that is. They said they know it's something with my joints, but what does that mean? So On plain film X-ray can be diagnosed on plain film X-ray, and there's 2 specifications needs to be there. Decreased joint space, so joint should be this big and we have less space, and then osteophytosis with the little bone spurs that grow in around it. When those 2 things are present on an X-ray, an MRI, a CT, any diagnostic imaging, we have the diagnosis of osteoarthritis. And sounds ominous for people. They go, oh no, I have arthritis, oh no. It's in
the spine, the osteoarthritis?
Yes, and we can see it at any joint in the body, so any articular surface, shoulders, fingers, anywhere.
Right.
And arthritis doesn't necessarily mean pain. It can just be wear and tear to a joint. At some point, all of us are going to have some form of arthritis. Now, we want to slow that down, of course, which is back to continue moving our bodies fluidly.
Yes.
But it's the inflammation and the muscle tightness and the compensatory motion in the human body that actually creates more of the pain. It's not directly the arthritis itself. So if you get that diagnosis of arthritis, don't all of a sudden, oh no, I'm broken, right? And they train clinicians nowadays too, so that we empower the patient to know that arthritis is there and we can grade the arthritis, but also it is not a death sentence, if you will. It is something that can be combated, and that's something that we can slow down significantly, if not halt altogether, with the right treatments.
Dr. Harris, is that genetic?
There is a genetic disposition.
I always like to ask.
There is. There's a small genetic disposition, absolutely, and how fast it's going to happen.
Okay.
And then we have other arthritides, or other arthritis, rheumatoid arthritis, psoriatic arthritis, enteropathic.
What are those differences?
So with those are metabolic and systemic. Those are going to be autoimmune. So the body is kind of attacking itself.
Interesting.
Whereas osteoarthritis is wear and tear, it's degenerative change.
Got it.
And it's important that we know the differences between those, and that people understand the difference, because some can be treated with medications. Osteoarthritis, not a lot of medications are going to directly treat the arthritis. It is truly physical medicine.
Yeah. And so what else can we do as, a patient where we have these illnesses? What else do you suggest as far as lifestyle? Do you suggest, I don't know, walking? Like, what can we do as home? If someone's listening right now and they're saying, I have that, what can they do at home to kind of...
So the best thing is to find a baseline of something first you enjoy doing physically.
Okay.
So walking is one of the best things you can do.
Definitely.
If you have the ability to walk, even if it's a half a mile or 100 yards, we want a graded exposure. Start with that 100 yards, start with a lap around the neighborhood, whatever it may be, and then slowly after 3, 4, 5 days of consistency, can we go to 150 yards? Can we do a little bit further, and we go from there? So walking's phenomenal. Low impact things in the presence of injury, whether it be arthritic change of the spine or shoulders, knees, hips, feet. We want to do some more low impact stuff too. Biking, cycling, recumbent bike, swimming is great. And when
absolutely.
It's 109 degrees in South Florida, swimming's awesome. So swimming is a really, really good cardiovascular thing you can do for the body, but also for the joints and the range of motion. Find something that is pain-free that you can do to start moving and start.
Yeah, like you said, movement. We just can't stop moving. We got to just keep
Exactly.
it. We got to keep it going. Surgery, I know we discussed surgery, things to consider before surgical intervention. I really like your philosophy at the Conde Center, where you really look at all the options and you don't just go straight to, okay, you need surgery. So that really makes our listeners feel that you're listening to the patient.
Definitely.
And we actually have 3 minutes left. Do you want to maybe tell us a little bit more about all the interesting devices and modalities and anything else in the next 3 minutes you want to share with us?
Definitely. So we highlighted some of the things we do on the physical medicine orthopedic side. On Dr. Conde's side, he is a diplomat in functional neurology. So he's a chiropractic neurologist. He does functional neurology training. He does anything from dementia, PTSD, post-stroke, concussion, anything central nervous system. Even if you don't feel like you're forgetting things, or if you've had an injury to the brain, to have a checkup and make sure that the brain is running efficiently. It is the computer for the body, right? It controls everything. So all of these functional neurological treatments help tremendously in knowing where you are, and then also just continuing to make sure that you're staying ahead of the curve.
Absolutely. Yeah. Any quick success stories that you have? Any? I know you have so many patients, but
We've
does
got a
anyone,
lot. We've got a lot. You know, the one that's really just catches me is a patient came in. She's been through hip replacements, knee replacement, all sorts
Yeah.
of different surgeries, and goals is big for me. What can you not do now that you
Yeah.
need to do? And hers was she wanted to stand at church. I want to be able to stand at church.
Nice.
So we worked and worked and worked, and she did everything. I guided her through the way, and she came in on the last visit, tears in her eyes. She says,
Oh, that's
I
amazing.
stood through church the first time in 20 years,
That's
and it was a
amazing.
high five and beautiful.
I love it. I love it. See, it's so amazing when you can reach those goals with the help of Dr. Harris and everybody at the Conde Center. Again, you can reach them directly at 561-330-6096 and check out their website, thecondecenter.com. Thank you, everybody, for tuning in, and we'll see you next week. Great show.
Thank you,
Thank
Lisa.
you.
Thank you.
Absolutely.
Thank you for letting us share with you